Welcome to our 2026 Mental Health News Education Reception. My name is David Minot, and I am the Executive Director of Mental Health News Education. And I want to thank you all for being here today as we come together to recognize and celebrate extraordinary leadership in the fields of mental health, substance use, and autism. I want to start by taking a special moment today to say that this event holds a very special place in my heart. As many of you know, last year my father, Ira Minot, we honored him with our Founders Award. And he recently retired at the end of 2025 after decades of building this organization from the ground up. Watching him receive that recognition, knowing what he built and what he means to this mission, reminded me exactly why events like today matter. This year's event takes place at a time, it kind of connects to how it's a time where even more than ever it seems that there's a need for education, advocacy, and truth. It's really never been greater. Across the country, we continue to see challenges, threats to Medicaid funding, cuts to mental health and substance use services, and rhetoric that promotes fear and misinformation about autism. Federal and state agencies that support the most vulnerable among us are facing deep budget pressures, and communities that depend on these services are feeling the impact, as everyone here is well aware. So in the face of all this, the mission of mental health news education has never been more critical than ever. We have two publications, Behavioral Health News and Autism Spectrum News, and they exist to provide hope through education. We offer trusted, science-based information and critical resources for individuals, families, and professionals who serve them. We work to reduce stigma, connect people to quality care, and make sure the voices and concerns of communities are heard by those who shape policy and services. Unlike some other publications, we don't chase headlines, we build community and understanding. And that's exactly what today is all about. None of this would be possible without the generous support of our sponsors. Thank you to our sponsors, and the dedication of everyone in this room. To our sponsors, partners, and board members, our readers, and our friends, thank you. We've had, over the 20 years, so 25 years, we've built up quite a community of partners. And of our 5,000 articles that we have in our library, everything has been volunteered. So we just are so thankful to everybody that has participated. Your presence and support today help make our mission possible, and we're deeply grateful. So today we are very proud to honor 4 extraordinary individuals whose leadership, advocacy, and innovation are changing lives and strengthening the systems that support all of us. And I look forward to seeing each of them recognized in just a few minutes. I also want to mention just one last time that we do have a 50-50 raffle, and I know many of you purchased tickets at the registration table by the entrance. Tickets are $25 each, for 5 to 100, and you do not need to be present to win if you have to get going. We will be drawing the winner at the end of this program, so if you haven't done so, feel free. Finally, I have to thank my board of directors, many of whom are here today. If you want to stand, just be recognized. Many couldn't make it because they were just across the country with their business doing other things. But they're phenomenal, and I highly recommend you take a moment to say hi to them because they're doing wonderful things in the world of behavioral health and autism. And one other item, a former board member who was on the board for almost 20 years, many of you may know George Petit. He has stepped down from the board recently, but we're all congratulating him as our new New York City Executive Deputy Commissioner of the Department of Health and Mental Health. So I'd just like to say, a little bit of time to say a few words, so come on, George.
David, hello everyone. Incredibly excited to be here. I want to congratulate all the honorees for this amazing recognition of the work that you do. As David said, I stepped down recently as I came into this new position. So I'm the Executive Deputy Commissioner for the New York City Department of Health and Mental Hygiene, and I am incredibly honored and humbled by the work that we're doing in partnership with all of the community-based providers, with city and state partners, with the primary focus of really ensuring that folks that need services get them at the right time, at the right place, in the right format. So we're really focusing on a lot of the issues that are coming down the pike in terms of some of the challenges federally with Medicaid and the HR1 bill, and really making sure that people aren't going to be falling through the cracks. That's our role in city government, is to make sure that everyone has access to low cost, no cost services. So again, incredibly humbled by this opportunity to step into this incredible role. For me as a public sector psychiatrist, this is kind of like the culmination, the pinnacle of my career aspirations. So I didn't realize it was 20 years, like wow. So it's a long time. And I love working with this board, and this event I think is one of the best events that we have every year, to being able to honor you all in the room. So again, thank you and have a great day.
Good afternoon, everyone. My name is Rachel Fernback, and I am honored to be the board chair for Mental Health News Education, and I have a few remarks. Just to let you know about me and my day job, I'm an attorney in private practice, and I'm also the executive director and general counsel for the New York State Psychiatric Association, which is a division of the American Psychiatric Association. So it makes perfect sense that I'm involved in this organization. It's my pleasure to welcome you to the 2026 Leadership Awards reception. Our annual reception has become a cherished tradition, bringing together leaders from the behavioral health and autism communities. Whether you're joining us for the first time or you've been here with us year after year, your presence and your support mean the world to us, so thank you for being here today. On your tables, you will find event packets with information about our distinguished honorees and our generous sponsors. Please scan the QR code on the front cover to access today's event journal, and look out for a follow-up email with a link to the journal after the event. Today we are proud to honor 4 extraordinary individuals whose leadership and dedication to our communities inspire us all. We look forward to celebrating each of them shortly. We also want to extend our heartfelt thanks to all of our sponsors, with special recognition to our top-level sponsors, our diamond sponsor, which is SOMOS Community Care, our platinum sponsors, Coordinated Behavioral Care and the Corporation for Supportive Housing, and our silver sponsors, Health Management Associates and Unique People Services. Thank you. We are also deeply grateful to the New York State Offices of Mental Health and Addiction Services and Supports for their generous grant support of our programs. Their vital contributions enable us to continue our mission of providing trusted education and resources for the mental health and addiction services communities. I also want to express my deep gratitude for our dedicated board and to our executive director, David Minot, for the tireless work that made today possible. So once again, welcome and thank you for your continued support. Enjoy today's celebration. And now it is my absolute pleasure to introduce Dr. Ann Sullivan, Commissioner of the New York State Office of Mental Health, who will share a few words.
Good afternoon, everyone. Hi. First of all, I would just like to thank everybody in the audience for everything you do. I know so many of you are involved in some way. Mental health, substance use, up here, the people's lived experience. Thank you for what you do each and every day. You are so critical to the work that we do throughout the state. And I bring that thank you from the governor as well. And I also, congratulations from the governor to the wonderful awardees who behavioral health. You always pick people who really do the work. And it's so exciting because thank you for your great choices of the awardees. And I just have to say that I was at a meeting of the commissioners, and one of the commissioners came up to me and spoke about the article on peers in the Behavioral Health News from another state. I believe it was Pennsylvania. So you're national, guys. What you are doing is having an impact out there across the nation. And when you look at that title, which is Mental Health News Education, I mean, it's a huge, huge effort to make sure that everybody gets to know the services, that everybody understands mental health, that it reduces stigma. And I checked on the website again, and you started in 1999. So that is incredible. That's 26 years of providing that kind of service to New York. I mean, that is really very, very special. So every time we have one of these, I think it's sometimes good to just look back and think of all the people that have been influenced by what these publications have done. And every time they're lying on a table somewhere, or someone picks them up, or they read them online, that you're fighting stigma, you're educating people, and you're letting people know about the services that we have across the state. So thank you so much. Thank you, Ira. Thank you, David. Thank you, all the staff of Behavioral Health News and Autism Spectrum News. And thank you for what you do, everybody in the audience, each and every day. I just have to give a shout out that, Mental Health America said that New York was #1 in mental health. And the reason, and that was on 17 various, pretty hard metrics that they used in evaluating states. And the reason we're #1 is because of all of you, because of the work that you do. And I think so means we're on the right path. We haven't done everything we need to do, but we're doing better all the time. So again, congratulations and thank you on behalf of our governor, who has been just incredibly supportive of mental health. And I think she would love to personally thank all the honorees today. But thank you so much for what you do. Thanks.
A lot of moving of this microphone, I can guarantee you. So now it's my pleasure to introduce Pascal Leone, Executive Director of the Supporting Housing Network of New York, to present the Supportive Housing Leadership Award. Please welcome Pascal.
Thank you for the 5-3, Michael. Good afternoon, everyone. And welcome. Congratulations, David and the folks at Mental Health News Education. The work that you do, as the Commissioner said, is so powerful, so forward-thinking, and so impactful, uplifting individuals, families, and communities. And congratulations to all today's honorees. I have the distinct pleasure of introducing the next honoree, and it's so fitting that it's the Supportive Housing Leadership Award, because this woman not only has shaped the supportive housing movement nationally, but so many of us have been fortunate enough to grow under her leadership. Deb De Santis. Since 2007, Deb has been a formidable force as the president and CEO of CSH, the Corporation for Supportive Housing, the nation's largest CDFI, which is devoted to housing solutions for people experiencing homelessness or at risk of homelessness, and a place that I was privileged to call home for 9 incredible years. And once a CSHer, always a CSHer, right? Right, Diane? Oh yeah. And under Deb's leadership, CSH has tripled its lending and support toward the creation of over 450,000 stable homes for individuals and families across the country. That is over 500,000. Yes, absolutely. There's so much I could say. I told Deb I was going to do 11-page paper, but I know I only have a couple minutes. But what stands out to me is not just her accomplishments and her vision, because they are indeed many and extraordinary. It is her quiet grace. Deb leads with a calming steadiness, a graceful humility, and profound compassion. She has this rare ability to make people feel both challenged and supported, deeply supported at the same time. I'll never forget one of my first days working directly for her when I was promoted to vice president, and at the end of our conversation, she said something that I carry with me every day. Know that I trust you implicitly, but never make the same mistake twice. At first it sounded simple. I was like, Pascal, don't mess this up, right? But what she was really saying is that you're allowed to learn here. Make room for growth. Mistakes only become failures when we fail to learn from them. And mistakes are evidence that we are brave enough to try. And so that kind of leadership and trust is rare in this space, and I want to thank you for that. And that those words truly changed me as a leader myself. But because, you know, someone who you admire so deeply, who trusts you, you want to rise to the occasion every single time. And that's the kind of leadership she instills with you. I grew up Catholic, and there was a saying back in the 90s, my mom had like a bumper sticker, you know, WWJD, and everyone had this, what would Jesus do? But in my trying of times as a leader, and there are many, I genuinely find myself asking, what would Deb do in this moment? And usually the answer is, lead with integrity, lead with calm, lead with humanity, and never lose sight of who you're working for. Friends, please join me in welcoming this extraordinary and courageous leader, mentor, and friend, Deborah De Santis.
Well, you are going to be so sorely disappointed after hearing Pascal. Oh my goodness. Wow. Good afternoon, everyone. I want to say just what an honor and a pleasure it is to be here with all of you. And I want to thank David and the board for this recognition, and I want to also acknowledge the other folks who are being recognized here today. You know, I came with two pieces of paper, really just because my colleagues get really nervous when they think I'm going to go off script, which I often do, so it's hard for me to read from the script. So let me try to talk to the heart, from the heart, since Pascal made a point of that. This is really important to me for a number of reasons. First, as a mother, I have a child who deals with serious mental illness. And as a mother and as an advocate on her behalf, I recognize my gaps, my faults, and the need for better education. I am a better mother and a better advocate because I can access information that makes me smarter about how I can best support my daughter and how I can support others. And I think I don't want to parrot what David said, but I think it's so important. We live at a very strange and challenging period of time, right, where information is so abundant and overwhelming at times, and it's so important that what we do continues to be grounded in fact, and there isn't a lot of value placed on facts these days. And so I look out at this audience and I see what you do every and each day, knowing that you're building the fact base, both in your knowledge and in your experience. And you can't put a premium on that. You know, I appreciated what you said, Commissioner. One of the first things I learned when I joined CSH was we're a national organization, and if you go to Kentucky and you talk about New York, it doesn't go over well. But the reality is that New York has set the standard. There is something about New York that is really special. There's a level of sophistication you can't find elsewhere. There is an expectation of collaboration and coordination that doesn't always translate outside of New York. And I think for me, certainly, that has been an important lesson. At CSH, we don't think of ourselves as the most important person in the room or the most knowledgeable person in the room. We see ourselves as facilitators, conveners, and perhaps instigators. People who amplify what we learn from our partners and then lift that up as an opportunity to replicate elsewhere. So, you know, my success, our success at CSH has everything to do with your success. And I thank you so much for that. I spend a lot of time these days thinking about joy, how to ensure that I have joy in my personal life, how to ensure that my colleagues don't lose sight of the need to experience joy. And I just want to say to all of you today that this experience here brings me so much joy that will bolster me for a good long time to come. So thank you so much.
Thank you, Deb. Please join me in welcoming Sherry Tucker, Chief Executive Officer of Wildlife Network, to present the Behavioral Health Leadership Award.
Wait for the music. Okay, very nice. Thank you for that. Good afternoon. It's so nice to be among all of my friends. There's so many friendly faces here today. Love to see everybody. The networking that we get to experience at all these events is such a special thing, and so many times we're stuck behind our desk with the camera, with the Zoom, and we don't get the opportunity to lay eyes on each other. So thank you for putting this together, and thank you, Pam, for asking me to introduce you. So it is my honor to introduce our next honoree, Pam Mattel, the Chief Executive Officer for Coordinated Behavioral Health Care, and she's today's recipient of the Behavioral Health Leadership Award, very deserving. Pam is a transformational leader whose career spans more than 4 decades of service in nonprofit healthcare. As CEO of CBC, she leads a network of nearly 80 community-based organizations working together to deliver behavioral health and primary care and housing supports across New York, bringing whole person equitable care to tens of thousands of individuals and families. Throughout her career, Pam has consistently taken on complex systems, made them stronger, more innovative, and more responsive to community needs. From her leadership roles at Acadia Network, the Institute for Community Living, and Public Health Management Corporation, she has driven growth, strengthened quality, and advanced pioneering models of care from health homes and care transitions to opioid response initiatives and value-based care. But what truly sets Pam apart is her unwavering commitment to collaboration and to reimagining systems in ways that center equity, dignity, and outcomes. She brings people together, providers, policymakers, and communities to create meaningful, lasting change in behavioral health. Guided by her mission to advance whole person care and inspired by the belief that everyone deserves high quality integrated services, Pam continues to shape the future of our field. On a personal level, I have found Pam to be one of the most creative, optimistic, and warm leaders that I have had the privilege to collaborate with. She's truly one of a kind, and I'm grateful for the opportunity to know her and work with her. Please join me in congratulating and welcoming Pam Mattel.
Actually, I want to say one thing first. As you were talking, I remembered a professor when I was leaving social work school, and he said, Professor Minkoff, and he said, relish this moment because it is the only time in your career when you will believe you know everything and you know nothing. I almost feel like that standing here this afternoon. Sherry, thank you for that introduction. It touched my heart. Thank you, Mental Health News, the board, Commissioner, everyone who's here, friends, family. Probably many of you know I also brought my son here today. And that, I think, is in relationship to what you were saying also, Deb, is that there's so many people behind us that cheer us on and support us and keep us optimistic and empathic. And Evan, you're one of those people, so thank you. Thank you all of you. Thank you all of you. I did say to David, this is like the favorite event for me. Every year I can't wait to come here. It's interesting to be here and not just one of the participants. And so thank you for that. I always thought leadership awards are a little curious because they spotlight one person for the work that's done by everyone. And I think, Anne, you started us off with recognizing that it is all of us that makes this work possible. So most importantly, I'll recognize at the outset the work done by the CBC board, and thank you for entrusting me to lead CBC. The nonprofit providers who show up every day to do some of the hardest, most admirable work there is, and to the CBC staff, some of which who are here, who rally around every day to be mission-driven and support agencies and staff. I really accept this award on their behalf and with the utmost gratitude for the work. The amazing part, I think you sort of shared this too, Deb, the amazing part about this field is that after 40 years, it is 40 years, I wanted to like jump up on the stage to show you how young I was. I still find myself fascinated with how much more there is to learn. I think that is shared by most of us. And I think because we know that leadership requires a natural curiosity to continue learning and growing. I was at the Blooming Health Summit last week, and Andy Slavitt, maybe you know him, political person, but he was there and he told a story that has stayed with me in such a way that my entire remarks are built around his story. So what he told was that when healthcare.gov launched a couple years ago and then crashed, he made a phone call to the White House and said, your site is broken. Do you need help? He was the only person who made that phone call, which is amazing to me. No one else made that call, so guess what? He got the job. And he was told he had 5 weeks to accomplish the turnaround. And all of us know when you tell a tech company that you have 5 weeks to turn it around, they're like, yeah, I'll get back to you in like 5 months. But he rallied the team and they got it done in 5 weeks. That one call changed the system and kept healthcare insurance accessible. And what struck me, which strikes me now every day, wasn't the boldness of his phone call, it was really the simplicity of the call. He saw something broken, he decided it was his problem, and he set out to fix it. We talk a lot about integrated whole person care and coordination. And still, I'm going to call out the obvious, multiple staff in different programs, all involved with the client, are still doing the same intake, the same assessment, developing care plans, and the care plans are not connected. We know a unified approach would work better, but we haven't quite figured out how to do that. And so I'm working with a small group of organizations at CBC that's answering that call to find a solution. We also talk a lot about hospital transitions, and I'll tip my hat to Anne for making sure that hospital transition is key in the work that we do. Each of the client's providers, when a client gets admitted or discharged from a hospital, each person calls the hospital. even if they're in the same organization. So there could be 5 people calling the hospital to inquire about how the client is doing and what the discharge bill is. And the hospital calls all 5 of them. You know, I had that feeling too when I heard this, like, wow, what an interesting, solvable problem. And so we know everyone individually is doing the right thing, but the result is a lot of duplication and the accountability is spread across too many people. What I hear at the forefront of this issue is the lack of trust between individuals. Can I count on my colleagues to make the call and keep me informed? And I think underneath that, if we were to re-engineer this process and document differently, would it stand up to an audit? So that small work group I mentioned is refusing to settle for that. And we're answering the call to find a way to share responsibility in the best interest of the client. It's tough work, but we are committed. We are fortunate, and I think as Ann said, and others, and Deb, in comparison to Kentucky and other places, we are so fortunate to live in New York State where the governor and the commissioners are truly fully committed to accessing behavioral health care. And in this moment in time, I know we all know that is a gift. And yet, I say very respectfully, more programs are making it harder to provide more efficient and effective care. Every well-intentioned new initiative adds another door someone has to find. We keep adding complexity and call it expansion. So CDC has been answering that call too, in part through centralizing intake and triaging to the best referral. However, at some point, we are all going to have to answer the call to re-engineer the way we collectively focus on the person. But actually, I know that that's achievable. 4 years ago, in deep partnership with OMH, CDC launched the Safe Option Support with the Bridge, ACMH, SUS, to deploy teams to go into the transit system to meet people where they are living, in the subways. It has worked because people kept making the call to the MTA, to DHS, to hospitals, to community providers, again and again over the past 4 years until something held. And as a result of thousands of small decisions made by individuals every day, more than 1,000 chronic street homeless people now have a place to go home to and feel safe. And with health and hospitals, we have an amazing contract with their Housing for Health program. Our contract together, CDC, community-based organizations, and the hospital worked really hard to create a system where we could literally work together seamlessly with great trust and admiration. And as a result of that, over the past 3 years, that group has also housed another 1,000 people in permanent supportive housing, moving people out of housing insecurity. What a great story to be telling every day. I just realized that, housing. The key lesson here, which I think you also talked about, is what worked: relentless focus on trust and belief that together is better than alone. That is what CBC is built on. No single leader or organization can solve these issues alone. We are at our best when we intentionally seek each other out. So my last example here, several years ago, I was at an Institute for Healthcare Improvement conference. A lot of medical people there. I'm like waving the flag for behavioral health, but I was left unhinged at the live demonstration of how artificial intelligence was changing care. How could this have happened so fast? Like, I think I'm like on the edge of things, but I had no idea about how fast things had changed. And what worries me is that our field is again at risk of being left behind. We've experienced this during the electronic health record transformation and multiple data advances. And I know, and I'm committed, we cannot be on that side again. So CDC is answering that call. A group of dedicated CDC agencies in partnership with MHNE invested the past 6 months to learn and challenge each other on what is AI and how we can responsibly use it. Everyone was leading everyone in that group. The vision, AI to reduce administrative burden and bring joy back to work. Wow, that's some call to answer to bring joy back to work. These examples call attention to the promise of leadership. Those are the problems amongst many others that we can solve one call, one email, one conversation at a time. So, when the moment comes, and it always does, make the call. Thank you.
Thank you. How about that band? So we are going to swap 3 and 4 on the program, AV. We're going to be skipping the Assemblyman and going to the last video. So before I introduce SOMOS, please enjoy this short video about our timeless sponsor, SOMOS.
Somos in Spanish means we are, and we are who we serve.
Dr. Ramon Tallaj came to the United States from the Dominican Republic at the request of the Catholic Church to help communities in need. His goal was to make equitable, culturally competent healthcare accessible to the most vulnerable communities throughout New York City. Dr. Tallaj created SOMOS, the nonprofit physician-led network of 2,500 healthcare providers serving over 1 million Medicaid and Medicare beneficiaries. By addressing the social needs of patients and building trust, SOMOS has empowered people to take control of their own health through preventative care, reducing emergency room visits, hospital admissions, diabetes-related complications, the need for dialysis, pediatric hospitalizations, and so much more, saving New York taxpayers billions of dollars. And when public health crises have struck, Dr. Tallaj mobilized the SOMOS network to the front lines, delivering care and safeguarding communities. Under his leadership, SOMOS provides care to 30,000 patients daily across more than 900 medical offices throughout Brooklyn, Manhattan, Queens, the Bronx, and Nassau County.
We are Somos, and together we are the American dream.
And now please welcome Dr. Paul Tallaj, Chief Medical Officer of SOMOS Innovation, to present the Community Health Impact Award.
I just know him a little bit. Good afternoon, everyone. My name is Dr. Paul Tallaj, and I have the honor of introducing today's honoree, Dr. Ramon Tallaj, an extraordinary physician, a visionary leader, a champion for community health care, and most importantly, my father. Introducing my father is always interesting because most people in this room know him as a leader. I know him as that too. But I also know him as the man who can turn a quick conversation into a 3-hour lecture on healthcare, politics, life, and that's usually before breakfast. And anyone who knows him, that knows him well, knows that when he says, I have a small idea, you should be prepared. Because that small idea may become the largest community-based healthcare network in the nation, encompassing over 1 million patients and 2,500 providers, focused on the innovative healthcare model we refer to as value-based care. But that is exactly what makes him so special. My father has never seen healthcare as simply treating an illness. He has always seen it as a mission to bring dignity, access, prevention, and trust to the communities that need it the most. Through his leadership and the creation of SOMOS, he helped build a model of care centered around community physicians, doctors who know their patients, understand their neighborhoods, and meet them where they are. That kind of leadership is especially meaningful today as we honor those making a difference in mental health, behavioral health, and the lives of the families. My father's always understood that the patients are not just diagnoses, that they are human, that they are people with stories, with fears, hopes, and families who deserve to be seen and supported. As his son, I've seen this passion up close. I've seen the long days, the endless calls, the big ideas, and even the bigger expectations. And as a surgeon myself and as his chief medical officer, I understand that depth now more than ever. He has inspired patients, doctors, communities, and of course, his own children. In fact, he has raised several physicians, which tells you two things. He leads by example. Today I'm proud, grateful, and deeply honored to introduce my father, Dr. Ramon Tallaj, as he is recognized as the 2026 Mental Health News Education Leadership Award reception.
Buenas tardes. See, I speak Spanish. At least they understand. Most of our faces are in many neighborhoods. Good afternoon, everyone. First, I want to sincerely thank the Mental Health News Education and the organizer for this meaningful recognition and for your extraordinary commitment to advancing awareness, advocacy, education, and dignity for individuals and families impacted by mental health challenges, autism, and learning disabilities. It's truly an honor to receive the Community Health Impact Award and stand alongside so many distinguished leaders whose commitment to service continue to make a profound difference in the life of others. And I mean that because I see now more people in position, our commissioner in the state, that now commissioner in the city, that they really mean they've been there. Sometimes I said to people in Albany when I meet with them, please come down. We're making a lot of rules. Come and smell one of the Medicaid patient. Smell one of those buildings that we work on it. You see why? It's the difference. You see why some people decide to open practices in poor neighborhood, not in Park Avenue, not what we are today. Just in those places that people have the needs. It's fortunate because the system, for whatever reason in life. I also would like to congratulate my fellow honorees. You will represent the very best on public services, healthcare leadership, advocacy, and community commitment. And I believe you all deserve together, all of us, round of applause. Somebody here like my son, Paul, for the presentation he did. To stand here today and share this moment with my family while continuing the work on serving our community together is something I'm deeply grateful for. It is a reminder that healthcare is not simply a profession. It is a responsibility passed from one generation to another. And that responsibility becomes even more important at the time that so many families are struggling silently with mental health challenges. And I will give some example I want to say before I finish. At SOMOS Community Care, we serve more than 1 million Medicare patients. You heard that across too many offices. And through the work we have seen firsthand, the mental health access remains one of the greatest challenges facing our community today. And I agree with you that thanks you, Lord, for the commission and the governor. Since they say 1 billion, things are moving. We are an example. Now SOMOS is being given for the impact program. We've been selected, and every single doctor in every single practice, in every single visit, try to score the patient for depression. The way if any change, we see it. It's not a preventive way, but it's a way to act early. And for that, Commissioner, thank you. Thank you. A recent New York City Health Department report found that almost 1 million people, 945, New York reported an unmet mental health treatment need within the past year alone, which caused stigma and lack of awareness continue to serve as a major barrier to care. For many individuals, primary care is often the first and sometimes the only point of contact with the healthcare system. Some of the people that I know, they are intimidated for the big buildings. And I always say that we have, let's go live in New York, close by. We have the best disease care of the world in those buildings, disease care. Therefore, people who was there is sick already. This is what my son referred to body-based care, prevention. When we decrease 35% in dialysis and amputation, for the system is money safe. From Maria Perez, who the organ doesn't lose the leg, and she's not willing here every 3 days to dialysis, need health, wellness, happiness. We all pursue. When a young girl, now we are social care network too, in the Bronx, goes in October 6 times to the emergency room because of asthma. 6 times, $10,000. And we went to her house with social care network access now. And we zoom all over the house. And we clean it with $400. She hasn't come back to the emergency room. That means a lot. Because you know, still 99.5% of the resources go to the building for people sick. And I advocate with you that a lot of resources should be put in the outside to do the prevention that's so needed for all of our people and our communities. This is why SOMOS continues expanding integrated behavioral health services directly within primary care setting to our impact program and our collaborative care model. Through early screening, one handoff, coordinated care, and ongoing follow-up, we are helping patients access behavioral health support in the same trusted setting where they already receive care. They're not afraid. They get it. They believe in the people. Because we cannot continue waiting until people reach moments of crisis before support becomes available. You know, the COVID-19 pandemic reminded all of us of the enormous emotional and physiological and psychological burden carried by families across our city, while also reinforcing the importance of trusted healthcare system rooted in the community. We all saw that. And it still was so difficult to call the people in the community frontline. They call frontline to the people who were in the building, where we send in the frontline the sick people, like in the battle, to call the hospital the frontline, not the place where the people are having the fight, and getting the one that's sent to the other places. Last month, in partnership with the NYU School of Research and Policy and the New York State Office of Mental Health, SOMOS hosted trauma-informed care training focused on strengthening workforce development and expanding behavioral healthcare support across our community. This work is about more than program. It is about restoring dignity, strengthening trust, and ensuring that people feel seen, heard, and supported before they reach a crisis. So today, I accept this award first to say thank you to the Lord, which has been my mentor, somebody like 2,000 years ago. And accepting not only on my own behalf, but on behalf of every physician, behavioral health professional, care manager, community navigator, and frontline healthcare worker who continue this work every single day the compassion and commitment to the main actor of this called life, the living job that we have, our patients. Thank you.
So our final award is the Autism Advocacy Award. And I'm sorry to say that Assemblyman Santabarbara cannot be here today because they're still working on the budget for the state. Apologies to those who were looking forward to seeing him. Assemblyman Santabarbara is chair of the Assembly Committee on People with Disabilities. His commitment to the autism community is deeply personal. When his son Michael was diagnosed with autism, it inspired him to dedicate himself to public service and advocacy for people with disabilities. That dedication has shaped his entire legislative career. Although the Assemblyman cannot be here with us today, he wanted to make sure he was still part of the celebration, and so we are glad he did. So let's hear from Assemblyman Santabarbara.
Hello everyone, this is Assemblyman Angelo Santabarbara with a special message from our state capitol. Unfortunately, because the New York State Legislature is currently in session, I'm unable to join you in person today. But I did not want to miss the opportunity to personally thank Mental Health News Education, publisher of Autism Spectrum News, for this incredible honor and to speak directly to everyone gathered for this important event. I'm truly honored to receive the 2026 Autism Advocacy Award. And I want to thank your organization for the important work you do every day to educate, inform, and support individuals and families in the autism and developmental disabilities community. As chair of the New York State Assembly's Committee on People with Disabilities, I've had the privilege of working on so many important issues affecting individuals with autism, developmental disabilities, and their families across New York State. But beyond my role in government, this work is deeply personal to me as the father of a son with autism. My son Michael changed my life. Before entering public service, I worked as a civil engineer. Like many parents, my focus was on building a career, supporting my family, and planning for the future. But that all changed when my son Michael was born. And our journey together, the challenges we faced, the systems we've had to navigate, the barriers we've encountered, and the lessons we've learned together, changed the direction of my life. That journey ultimately led me here to the New York State Assembly, gave me the opportunity to serve as chair of the Committee on People with Disabilities, and to have the opportunity to work alongside all of you for people who are too often overlooked, underestimated, or unable to advocate for themselves in these halls of government. When you live this every day as a parent, you gain a very different perspective. You see where support exists, but you also see where systems fall short. You see how difficult it can be for families to navigate services, access communication supports, and find opportunities for independence and inclusion. But you also see what's possible when the right supports are in place. When a child is understood, given the tools to communicate, encouraged to learn, and empowered to be part of their community. That perspective continues to shape the work I do every day. Over the years, I've had the opportunity to work alongside self-advocates, families, providers, educators, and organizations across our state who continue pushing for meaningful progress. Whether it's improving access to services, expanding housing opportunities, strengthening educational supports, improving communication access, addressing workforce shortages, or creating greater opportunities for independence and inclusion. And while progress has been made, we all know there's still much work to do ahead. I say this many times, my son is my angel. He doesn't talk much, but he reminds me every day what we're fighting for, why this work is so important. Too many families still struggle to access the supports they need. Too many individuals continue facing barriers to housing, employment, transportation, communication, and so much more. and too many people are still underestimated simply because they communicate differently. That's why advocacy matters. And that's why organizations like Mental Health News Education and Autism Spectrum News play such an important role in raising awareness, elevating voices, and helping move these conversations forward. I also want to take this opportunity to recognize all the families, the caregivers, the providers, educators, and advocates joining us today. Your work changes lives, and your advocacy continues helping build a more inclusive future for people with disabilities. I'm honored to stand with you in that work, and I remain committed to continuing the fight for dignity, opportunity, communication, access, independence, and full inclusion for all. So from me, from my son Michael, from our family, a heartfelt thank you again for this tremendous honor. I hope everyone enjoys this wonderful event, and I look forward to continuing our work together in the years ahead.
I think a wonderful message. I think resonates with a lot of us. So what an afternoon this has been. We used to do this at night, but I think the afternoon brings a little liveliness to it, and you get to see the beautiful view. I come from up north a little bit, so to me this is novel. I know a lot of you see this every day. I think I speak for everyone in the room when I say that we just witnessed something truly special. 4 extraordinary individuals, each of them doing work that really makes a difference in people's lives every single day, and it's really an honor and privilege to celebrate them today. I also want to thank the presenters who introduced our honorees beautifully. Your words clearly came from the heart and made this afternoon all that much more meaningful. To our honorees, Deborah, Pam, Assemblyman Santabarbara, and Dr. Tallaj, thank you for the work you do every day for the communities we all care so deeply about. And everyone else in this room, our board members, sponsors, partners, readers, friends, and family, your presence here today is itself a statement of commitment to our mission. The behavioral health and autism communities are stronger because of you. This is why we do what we do, because there is a community of dedicated, passionate people who show up, speak up, and who refuse to give up on people who need us most. Before we say goodbye, a couple things to take care of. First is our raffle drawing. I would like to say that we've hit a record this year. We've sold $1,000 in 50/50 raffle tickets, so thank you so much for your support. If we can have a drum roll for that raffle. Step 703. 8, 6, 7. Hold that. I don't have the money here, so.
If you'll refund my ticket price.
You got it. Okay. Very generous. Thank you. So, and thank you all for your support, really. It helps us do what we do. And finally, we'd love for our beautiful centerpieces to go home with you today. So at each table, whoever has the birthday closest to today, May 20th, you can figure out who that would be, and congratulations to our winners. Thank you so much for joining us today. I hope you leave here feeling as inspired as I do. Safe travels, and we look forward to seeing you again next year.
Thank you.